Today I'm joined by Ralph Highnam, who's the CEO and founder of Volpara Health Technologies. Volpara listed about 18 months ago, and since then it's been on a very interesting journey. The company held its AGM the other day, and some very interesting insights came out of that, which I'm going to talk through with Ralph. But Ralph, I might just start by asking you to tell us again about the Volpara story. Tell us about the technology.
Yep, so Scott, we are a breast cancer detection company. We write software from our base in Wellington, New Zealand, to really help drive improved quality and density assessment of breast x-rays to improve breast cancer screening globally. The technology was originally from the University of Oxford. We now have an engineering team really building up in Wellington, and a great sales force of about 15 people now in the US. We are installed in about 36 countries around the world, and we just hit a kind of landmark for us, which was just over $11 million now of orders since we started the company in 2009.
Yeah, that's very impressive. I mentioned you had your AGM the other day, and you provided or updated the market with some guidance that you've given. Do you want to talk us through some of those key points that the investors need to keep an eye on?
Yep, so I think it really shows the stage of the company that we're at. That we gave a forecast for the first time this year. So at the start of this financial year, which for us is 1st of April, we actually said we were going to aim for to exceed 200% growth in annual recurring revenue. As of today, basically, we're already 90% up in terms of annual recurring revenue compared to last year. So we're well on our way to actually meeting our target, even though Q1, Q2 are actually our slowest quarters. So we're coming into our strongest quarters now, and we look well on course to actually meet those targets.
Okay, can you tell us a little bit about some of the customers that you've signed up and what you've told the market in terms of future customers?
Yeah. So we're picking up, obviously, Luminaries, which we've told the market about so far, like Stanford, University of Virginia has come on board. One of the big ones we were very pleased to get recently was the University of Texas Southwest, which has got a huge reputation across Texas. And we're working on many other kind of real luminary top-level ones across the US and indeed elsewhere. And we're expecting, as you know, to launch into a big new project in the UK, which is the world's biggest breast cancer screening program over the next few months.
Well, that sounds very exciting. You mentioned you've got a strong sales force in the US. Where have those people come from, and what's their sort of level of expertise?
Yeah, so at the start of last year, we brought on Julian Marshall from Hologic, which is the world's biggest X-ray company. So that was the start of 2016. And around the same time, we brought on Mark Conager as Chief Commercial Officer based in Nashville. Mark came basically from GE. Those two set about recruiting, with the help of our existing sales staff, the best breast imaging people that we could find across the US. So many of these guys actually came out again of GE and some of the other big breast imaging vendors. We took the decision early on to go for quality over quantity. So we've got 7 guys now, feet on the ground, going around the US. And I think it's fair to say they're very buoyant. They've all got a very strong pipeline ahead of them. And they're finding our product, in particular our quality control product, Volpara Enterprise, to be very well received.
You also told the market about the percentage of screens in the US. Can you tell us what you're expecting to achieve over the next 12 months and what that actually means?
Yeah. There's 40 million women a year get screened in the US. It's by far the biggest screening market in the world. At the end of FY 2017, which is April for us, we were screening just around 1% of those women. At the end of this year, we want over 3% of those women to be getting imaged and looked after, if you like, by the Volpara software.
Okay, well, it sounds like there's a lot of interesting news and work ahead for the company. I might leave the conversation there. I've been joined by Ralph Highnam, who's the CEO and founder of Volpara Health Technologies. Thanks, Ralph.